Welcome, everyone, to the 2025 Let's Talk virtual webinar brought to you by the UCLA Women's Cardiovascular Center. My name is Dr. Marcy Press, and I'm an interventional cardiologist at UCLA, co-director of the UCLA Women's Cardiovascular Center, and it's my pleasure to welcome you all here today, and thank you for joining us. Our theme today is Let's Talk, Stress and Your Heart, Wildfires, Uncertainty, and Resilience. We will feature our outstanding panel of experts covering topics such as stress, hypertension, and nutrition, and we'll hear some amazing patient testimonials throughout the presentation. We will also have a Q&A session at the conclusion of the webinar. If you have any questions during the webinar, please enter them in the chat and we'll try to answer as many as we can at the end of the session. It is my absolute pleasure to introduce our special guest, Gal Gadot. Gal Gadot first gained recognition as Miss Israel 2004 and has progressed in her career as an acclaimed Israeli actress and producer. She is well known for her role as Giselle Yashar in the Fast and Furious franchise and catapulted to fame in 2017 with her portrayal of the DC Universe superhero in Wonder Woman. Since then, she has reprised the role in Justice League and Wonder Woman 1984, and has also starred in several other celebrated movies. This year, she will star as the evil queen in Disney's live-action adaptation of the 1937 film Snow White. Beyond her acting work, Gadot co-founded the production company Pilot Wave Motion Pictures. She is known as a champion for women's rights and empowerment, including her work with National Geographic Presents Impact with Gal Gadot, following 6 women from around the world who have made an extraordinary impact on their communities. In 2018, she was named one of Time's 100 most influential people.
Hey everyone, Gal Gadot here. I wanted to take a moment to talk about something that's incredibly important, our health, and more specifically, our hearts. As women, we're so used taking care of everyone around us that very often we forget to take care about ourselves. We push through even when something feels off. But I must say that I've learned firsthand just how crucial it is to listen to our bodies. I had my own health scare last year, and I realized how important it is to trust our intuition. If something doesn't feel right, don't ignore it. Our bodies are always speaking to us, and it's up to us to listen. What I was amazed to learn is that, did you know that heart disease is the #1 cause for death for women? Many of us don't even realize that we're at risk. And that's why regular checkups are so important, especially if you have a family history of heart disease or other risk factors. Prevention and early detection are truly make all the difference and can save lives. Your body is your best ally. It's always communicating with you, and make sure you listen. Taking the time to check in with yourself, prioritize yourself, your health, and take preventive step that can save life. So let's commit to making our health a priority. Take time to listen to your heart, both emotionally and physically, and don't hesitate to seek help if something doesn't feel right. I'm sending you all of my love from the bottom of my heart. And remember, you're your best advocate. Stay safe, stay healthy, and take care of yourself. Mwah. Bye.
Thank you so much, Gal Gadot, for that wonderful introduction to our session today. Next, I'd like to welcome Julie Rowland to guide us through a mindful moment together so that we may begin these discussions with togetherness and an open mind.
Thank you, Dr. Press, and welcome to everyone, all our Welcome. Let's stop before we start and take a moment to come into the moment. With the eyes opened, turn your head and look around the room that you've decided to attend this webinar in. So this is orienting, and this is what we naturally do to make sure that we're safe in space and time. And now turn your gaze toward the screen. And you can keep your eyes opened or you can close them. Both options are correct. And from here, bring awareness to the contact points of the body, parts of the body that are in contact with the seat, maybe the feet on the floor. And now let that go as you bring your awareness to temperature, noticing the temperature of the body where it's exposed to the air as opposed to clothed. The body only knows the moment. Let's continue to use these somatic sensations as you let temperature go and bring your awareness to sound, becoming very aware of your ability to hear. Sounds inside of the room, maybe sounds outside of it. And now let that go. And with the eyes opened or closed, notice sight. If the eyes are closed, noticing shadow and light. If the eyes are open, noticing color and texture, distance. And now let that go as you bring your awareness to touch of the clothing on the body, maybe glasses or jewelry. And now flip the palms toward the thighs if they aren't already here. We tend to feel safer when the palms are turned toward the thighs. You can keep the hands here or make a loose fist with the right hand and cup it with your left and bring it in front of your heart as we set the intention to come to this webinar with an open heart and an open mind, ready to listen. If the eyes are closed, slowly open them as we come together in this shared space.
Thank you so much, Julie. I also wanted to briefly share with you some background updates and highlights some special individuals from our center. For those of you joining us today for the first time, I want to share with you our mission. Our mission includes providing cutting-edge clinical care to our patients, engaging and supporting in cutting-edge research, and performing outreach to vulnerable populations, as well as educating our community. After all, heart disease remains the #1 killer of women. Prevention, early diagnosis, and treatment remain our #1 priority. Ensuring that our patients, first responders, and health community at large are armed with the knowledge to fight heart disease. It is this common mission that drives each of us to work together as a team and continue to build this center. It's hard to believe that this year marks our 10th anniversary. I remember as if it was yesterday when myself, Dr. Carol Watson, and Dr. Tamara Horowitz met each other for the first time 10 years ago, and we began to dream of the center together. Throughout these 10 years, our team has grown exponentially, and together we have accomplished so much, from teen heart health programs to use of virtual reality to establishing a wellness program that acknowledges and finally offers support and treatment for stress and anxiety, and securing funding for future clinical research in women's heart disease. It has truly been an absolute pleasure to work with this incredible team of women. And with no further ado, here they are. You'll have a chance to meet each and every one of them today on our panel. I also want to introduce the UCLA Cardiovascular Wellness Program run by our fabulous team shown here, who you will also meet later in this presentation. This year, our very own Dr. Carol Watson was sworn in to the U.S. Department of Health and Human Services Committee on Minority Health, bringing her expertise in health disparities to influence U.S. healthcare policy. Huge congratulations on this very important appointment, Dr. Carol Watson. This year, our very own Jolie Bush, member of the UCLA Women's Cardiovascular Center Advisory Board, developed the very first responder continuing education course. This 30-minute online module will be used for continuing education in fire departments throughout Los Angeles and simultaneously be introduced to paramedic, ER technicians, and UCLA medical students. Jolie has been an incredibly devoted member of our advisory board, and her commitment to improving care for women in our community has inspired us all. Thank you, Jolie. Sadly, this past January brought this community one of the worst natural disasters to impact LA in recent history. The impact of the fires has affected all of us in so many ways, from losing homes, experiencing feelings of fear, loss, and anxiety, impacting our physical and mental health. Our very own Dia Collins, our administrative director, and our son Garrett worked mornings, nights, and weekends, joining a community fire brigade, clearing neighborhoods of debris. Thank you, Dia and Garrett, for all you have done and continue to do for our community and patients. You inspire us all. Okay, finally, let's talk. Our first speaker today, who many of you I'm sure already know, is Dr. Carol Watson, who will talk about wildfires, air pollution, and heart health. Thank you, Carol.
Thank you so much, Marcy, for introducing all of these wonderful people to our wonderful center. Our center does a lot of research, and one of the things we study is air pollution. And you won't be surprised to learn that fires are one of the biggest sources of air pollution. Anytime a natural disaster happens, there is a collective trauma to an entire community. These fires were absolutely no different. And when there's a collective trauma, the heart suffers. A prototypical example is the Northridge earthquake from 1944. Investigators looked at the number of cardiac deaths that tend to happen every year in January. January 1991, there's about 50 cardiac deaths. January 1992, about 50 cardiac deaths. January 1993, again, 50 cardiac deaths. Then 1994, January 17th, on the day of the earthquake, there were more than twice as many cardiac deaths. Anytime there is a shock to the system, the heart suffers. But when you start thinking about air pollution or forest fires, there's something else going on as well. If you can smell it, then chemicals are entering your body. In the case of forest fires, there are many things: carbon monoxide, PM 2.5, which I'll talk a lot about, other things that are toxic. Now, our body has many mechanisms to filter out a lot of the bad stuff. But what it can't filter out are the really tiny particles that will go to the bottom, called PM 2.5. This is a schematic showing you what PM 2.5 is. They are those teeny tiny microparticles. Their diameter is less than 2.5 micrometers, and they get deep into your lungs. And when that happens, an inflammatory cascade is set off that affects not only the lungs, but every part of the body, and especially the heart. This is a schematic that shows you a human hair in the middle. You can see PM 2.5 particles are so tiny. They're just a fraction of the size of a human hair. And down there, you see a grain of sand. They are much smaller even than a grain of sand. Now, many studies have been done looking at the effect of PM 2.5 exposure and cardiac risk. In this study, they particularly looked at cardiac arrest or sudden cardiac death. This line in the middle is called the line of unity. Anything above that line means there's increased risk. Anything below that line means there's decreased risk. And if it's right on the line, there's no increase or decrease. You can see whenever there's heavy smoke density, there's an increased risk of cardiac arrest. As soon as this density goes away, medium or light, that risk goes away. The really awful thing about the fires we just experienced is that we went an entire month with heavy smoke density, so keeping us at risk that entire time. There's also data that suggests that women, as compared to men, are at more risk for the same amount of PM 2.5 exposure. You can see the increased risk for women appears to be higher than the increased risk for men on those heavy smoke days. A lot of that is probably just related to the fact that women tend to have a smaller body size than men, so they're exposed to a greater concentration. but regardless, women seem to suffer more than men. Now, in our center, as I mentioned, we do a lot of research, and one of the studies we've done for the last 15 years is on air pollution and cardiovascular risk. We have combined with a number of centers and investigators around the country, us here in Los Angeles, people in Chicago, Minnesota, Baltimore, New York, and North Carolina. What we saw in all of these studies, we did air quality measuring inside the home, outside of the home, and we saw that individuals who were exposed to more PM 2.5, the greater your exposure, the higher your cardiovascular risk. And there was no threshold. The good news, though, is we also do a lot of work with the EPA. So we can see that exposure to PM 2.5 is actually going down. Each of these lines represents one of our 6,800 patients in our study. And over time, you can see the PM 2.5 exposures are going down. That's what research can do. I think we have a lot of information. We know the risk, and we know what we can do to decrease the risk. Well, I'm really happy to be able to call up my wonderful colleague, Dr. Salzman, who's going to talk to you now about traumatic stress in your heart. Dr. Salzman.
Well, thank you so much, Dr. Watson, and good afternoon, everyone. Even if I don't know each and every one of you, I already know that if you live in Los Angeles, you have been directly or indirectly affected by the fires. I am sure you have felt the fear, the frustration, and the anxiety associated with the sudden shock of a stressful situation. Due to its effect on the brain, stress will shape our emotional and physiological response. The feeling of threat associated with all forms of trauma will change our decision-making process and our sense of judgment. Under the pressure of traumatic stress, we lose our capacity to address challenges in a constructive way. We lose track of reality, and we tend to favor impulsive and emotionally driven situations. This is why the cardiologist of the Women Heart Center that you're meeting tonight collaborate very closely with the wellness team to help patients make important decisions for their health. So to understand acute stress reaction, I propose we compare the flow of life to the flow of blood that is constantly circulating through the heart to keep us alive. Every day, we go through experiences, situations, feelings, thoughts that create the stream of our lives. The same way, the heart pushes blood through the body, creating a beautiful and ongoing flow of energy inside the body. But when a plaque ruptures unexpectedly in an artery, it creates a blockage. When a fire starts in Pacific Palisades or Altadena, we must save our lives and evacuate. These unexpected and life-threatening shocks disrupt our body, our lives, and more importantly, disrupt our belief that we are invincible and that we will always be in control. We lose our sense of identity. We feel vulnerable, isolated, confused, broken. Our sleep is disrupted. We don't feel safe any longer. This is the face of trauma. Like a heart attack, traumatic stress hurts. Life seems to have changed for the worse in minutes. We feel a great sense of loss. We don't know what the future holds. Life feels chaotic and uncertain. One of the most important markers that will help you monitor the effect of stress is your quality of sleep. If you have trouble falling asleep or staying asleep, and you find yourself spending hours awake, ruminating at night, this is very likely the sign that you need to seek help. One of the thousands of women I have met over the years who have recovered from a heart event and or from a trauma, many of them blame themselves and feel very guilty. They say things like, well, I could have or I should have done better with my life and with my health. This sense of shame after a traumatic event is not unusual, but it needs to be addressed quickly by a professional in order to begin the post-traumatic recovery, keeping in mind that emotional stress, when it is ongoing, when it's chronic, can cloud our perception and alter our personality, potentially leading to chronic depression and anxiety. The good news is that the body and the mind are resilient. Dr. Jafari, in our next presentation, will discuss ways to maintain good heart health. The same goes for our emotional well-being. We all have the capacity to move out of chaos caused by traumatic stress to recover a sense of balance and a sense of well-being. Maintaining stable structures in our daily life is essential to counter the effects of unpredictable events. Paying attention to your quality of sleep will help reduce toxin in the brain. Surrounding yourself with loving and supportive people, that's very important, who could be there for you the same way you can be there for them, will lessen fear because you will feel connected again. As much as you need a cardiologist and a full staff to help your heart beat and regain appropriate blood flow, the only way I know to recover from trauma is to seek support and love. So if there is one message I would like to convey to you today, do not underestimate the effects of tragic and stressful situations on your mind and on your heart. Pay attention to your heart, pay attention to your blood pressure, pay attention to your emotional pressure, be close to good and loving people. At the Women Cardiovascular Center, we know that together we will continue going through the flow. This is why we have an amazing support group led by Amanda Daniels and Alisa Beckett. They meet once a month to support and connect all our hearts. It's now my pleasure to introduce Dr. Lua Jafari.
Thank you, Anne. All right, next, let's talk about how mental stress impacts your blood pressure. High blood pressure, also known as hypertension, is the most preventable risk factor for cardiovascular disease. High blood pressure increases your risk of stroke, heart attack, heart failure, and death. But with treatment, we can reduce these risks by up to 40%. So having a healthy blood pressure is really essential for heart and cardiovascular health. Your nervous system plays a key role in regulating your blood pressure. Next slide. It's controlled by a careful balance between your sympathetic and your parasympathetic nervous system. Your sympathetic nervous system is your fight or flight response, what gets activated in the setting of an emergency or trauma. Your parasympathetic nervous system is your rest and digest system, what gets more activated in a relaxed state. In the setting of stress and overactivation of that sympathetic nervous system, your body releases stress hormones like cortisol and adrenaline. And that causes your blood vessels to constrict or tighten and your blood pressure to go up. This blood pressure response is transient. And so once you're removed from that stressful situation, your blood pressure will go back to pre-stress levels. However, in the setting of chronic mental stress, this can contribute to an always overactive fight or flight response and a persistently or more severely elevated blood pressure. And the impact of stress on your blood pressure is very complex. It not only increases levels of stress hormones, but also leads to activation of your immune system and vascular dysfunction. All of these cause not only high blood pressure, but other risk factors for heart disease like alcohol use, obesity, impaired sleep. So while chronic stress is unfortunately quite pervasive in our society, it's often an unappreciated but very important risk factor for heart disease. Also, the blood pressure response to stress can really vary between two individuals. This graph here depicts two people's blood pressure throughout the day. You can see on average, person A in red has average higher blood pressure than person B in blue. But also, when they're exposed to mental stress, as indicated by this arrow, blood pressure, person A has such a steep spike in their blood pressure compared to person B. And while having transient spikes in our blood pressure to stress is normal, actually having a more exaggerated blood pressure response to mental stress is linked with the risk of developing hypertension and heart disease. However, we know that participating in regular exercise positively influences stress activation centers in your brain. Most people know that exercise is important for heart health, for help lowering blood pressure, but those who perform regular exercise have actually been shown to have lower activation of key emotional stress centers in the brain. And this lower activation of stress centers in our brain is one of the mechanisms by which exercise reduces the risk of cardiovascular disease. So following guideline recommendations for physical activity, which is 150 minutes of moderate intensity exercise per week, can help modify how stress influences your brain, your blood pressure, and your heart. So in conclusion, stress management is really key for a healthy blood pressure and a healthy heart. Thank you. Next, I'd like to invite Andrea, one of our patients, to share her story.
Hi there, good evening. I'm Andrea DeMorella. A little about myself, I'm a business manager, a mother of two, and a wife. So I'm also a patient of Dr. Watson as well as Dr. Ann. And like most women, you know, I definitely am the caregiver in my family. And I was referred, or my primary doctor, you know, told me that I really should see a cardiologist. So I sought Dr. Watson out because I was interested in a doctor who specializes specifically in women's cardiovascular health. And it was during a visit with Dr. Watson that she shared with me this really great and unique opportunity to connect me with mental health resources and a nutritionist and other resources. And I was pleasantly surprised that that was even being offered. And that's where I connected with Dr. Ann and sat down with Dr. Ann. And it's been, I'm just really grateful for this program because we hear all the time that stress is bad and, you know, it can definitely negatively impact your health. But Dr. Ann was able to really break it down to me in physiological terms, just like we all just heard just now, and really help me make that connection, how important it is to manage stress and to try to, you know, try to get a handle on things. And I do suffer from high blood pressure, and I'm definitely at risk for heart disease. So I just in an effort to get in front of, you know, my risk factors and manage my stress levels and everything, I jumped at the opportunity to take advantage of the resources that were being offered through this amazing program. I can't overstate how grateful I am and how much I value the work that's being done to just bring awareness, and I just feel fortunate to be in these amazing doctors' care. As my family, you know, as the elder women in my family are growing much older, I find myself in this unique position now of now being sort of a matriarch role. And, you know, like I said, we tend to put ourselves last on the list. So I'm just, you know, I'm learning a lot and uh, and finding out ways to manage stress and to have a get more proactive and have a healthier lifestyle, you know, through exercise and managing stress and just putting myself first. So I just want to, before I go, I just want to say thank you so much for just the work that you all do. It's extremely important. So thank you.
Hello, everyone. My name is Nicole DeBona. I'm the registered dietitian with the Women's Cardiovascular Center, and today I'm going to be speaking about nourishment as a form of self-care. Next slide. All right, so to practice nourishment as self-care, we want to focus on consuming whole, minimally processed foods and avoiding highly or ultra-processed foods. This is because whole foods provide the body with all of the necessary nutrients it needs to function at its best. Another component to practice is mindful eating. So mindful eating is being present in the moment with food preparation and consumption. This can be done by using all of our senses, sight, smell, hearing, touch, and taste, as well as choosing foods that nourish the body and foods that we enjoy, which means removing any labels such as good or bad from food. Remember, food doesn't have morality. And there's also an element of an awareness of how we're feeling. When we're feeling challenging emotions, we often reach for more processed foods, which can provide momentary relief, but do not actually address the emotion we're feeling. You want to use skills and techniques mentioned by Dr. Ann and Julie to address the emotions without using food to cope, because a higher intake of ultra-processed foods is linked to an increase in depression and anxiety. When consuming whole foods, you're benefiting physical and mental health. All right, so the Mediterranean diet is a whole food-based way of eating. The emphasis is on consuming fruits, vegetables, whole grains, legumes. These are our beans and lentils, nuts and seeds, and plant-based fats. So think of your extra virgin olive oil, avocado, and again, nuts and seeds. We want to have a moderate intake of lean animal proteins, including poultry, fish and seafood, and low-fat or non-fat dairy, with little to no intake of processed foods. So think about most things in a package, refined carbohydrates and refined sugars, refined grains, and saturated fats, which are found in red meat, butter, full-fat dairy, and tropical oils, coconut and palm oil. So when we're eating for nourishment, we want to increase our intake of plant foods, make nourishing swaps like snacking on nuts versus chips, replacing refined grains with whole grains, eating fatty fish like salmon or sardines. If you prefer more mild fish, you might enjoy black cod. Eating fewer fast foods and convenience foods, using fresh and dried herbs and spices to flavor your food, practicing mindful eating. And remember that a little bit of preparation goes a long way, even if it's just to chop up some vegetables that can then be used in a snack or easily added to recipes later on in the week. I would now like to introduce one of our wonderful patients, Dr. Judy Turner.
Hi, everyone. I don't think my video is working. Let's try this again. There we go. Great. Hi, everyone. My name is Judy Turner. I'm a physician anesthesiologist. I've trained, studied, worked at UCLA for more than 25 years. My main work is in obstetric anesthesia. That's my clinical work, but I'm really involved in leadership of teaching and education. That's probably my main job. You can imagine as a physician, work's been very challenging, especially since COVID, but, really the demands have also increased just in the last few years. Patient care demands, clinical demands, really just everything. So my situation happened a little over a year ago. I was on a road trip with some family, and we had some problems. It was a stressful day. I ended up getting into a really big argument with one of my family members, which I never do. And, so really stressful day. The next day, we made up, had a good day, talked it out. It was good. I went to bed that night or got ready to go to bed and apparently passed out, hit my head, had a huge gash on my forehead. I don't really remember any of that. My husband took me to the emergency room. I was starting to kind of really be more aware of things at that point, thought it was just a gash on my forehead. But it turns out I was in a kind of an unstable heart rhythm. And so the ER docs called cardiology. They came and saw me, made some recommendations, and recommended some testing. So I ended up having an echocardiogram, which is an ultrasound of the heart. And the motion of my heart wasn't completely normal. And the thought was that this might be contributing to this irregular rhythm. It was all pretty unusual, and it kind of looked like I was having, an acute coronary event or a heart attack. But I knew I didn't have most of the major risk factors. I didn't have hypertension. I didn't have hyperlipidemia. I'd never been on any medication. So I just really couldn't believe any of this was happening. And but Dr. Hingorani was my cardiologist. I met her that early that next morning, and she recommended that I have an angiogram to rule out coronary artery disease. And eventually I agreed. And fortunately, I didn't have coronary artery disease, but she explained that what it looked like, and what I finally now understand it was stress cardiomyopathy, or it's also known in the press as broken heart syndrome. Again, I was in a lot of denial about all this, really couldn't believe it happened. But as I looked into it, it turns out that most cases are middle-aged women who don't have necessarily a lot of other risk factors. And, that kind of fit me. Fortunately, it's not something that leads to long-term damage in most cases. And hopefully I seem to be making a pretty much a full recovery. I really appreciated Dr. Hingorani giving me a lot of information and really including me in decision making, which, just as a patient, but also as a physician, that was really important to me. In addition to Dr. Hingorani, I got a referral from staff and faculty counseling with a great therapist that's been very helpful. I don't think that one argument that I had was what led to all this, but I think it was an accumulation of stress, and maybe that was the tipping point. Like Dr. Saltzman said, it's also, cardiac events can, lead to depression later. And I definitely have, had to be really mindful of that, a year out. And, really just trying to take better care of myself. So in addition to getting physically healthier, I'm really trying to manage my stress better and learning, kind of coping strategies, using clear and open communication and conversations, not only with my family, but also with colleagues. Really being intentional about taking time away from work, being more realistic about my own expectations. And I really agreed to do this, present my situation in the hopes that, somebody else might, be able to recognize that, if it can happen to me, it can happen to you, and to just really be aware of the impact that stress can have, and especially emotional stress, that how it can impact our lives. So yeah, that's my story. Thanks.
Hi, everyone. I'm Tamara Horwich, one of the cardiologists. And thank you so much, Judy, for telling us that story. That is a case, very common presentation of stress-induced cardiomyopathy, which I'm going to tell you a little bit more about right now. So Dr. Watson mentioned the 1993 Southern California earthquake that occurred in Northridge. And now I'm going to turn our attention to another natural disaster earthquake, which happened February 22nd, 2011 in Christchurch, New Zealand. And the reason this is a good earthquake to study, and it was studied, is because New Zealand, as you know, is an island country. Christchurch is on the southern island, which is relatively small with only a couple hospitals. So it's very easy to follow hospital admissions and what happens on certain days or certain weeks. And as you can see in this graph here, the researchers looked at acute cardiology admissions for chest pain the week of this earthquake in 2011. And as you can see, the week of the earthquake, there were significantly more admissions to the hospitals for chest pain compared to the week before, 2 weeks before, and the 2 weeks after. And when they looked more closely at what are these increased admissions coming in, they saw that most of them were stress cardiomyopathy. 21 cases happened within 4 days of the earthquake. All the stress cardiomyopathy cases were women with an average age of 68 years. And this does tend to 90% of the time happen in postmenopausal women. Interestingly, there were no cases of stress cardiomyopathy on the southern island of New Zealand in 2010, the same week of February 22nd. So really showing us that there was just this bump up at the time of that natural disaster. So let's go a little deeper, and Dr. Turner told us so much, but I'm going to review it briefly. Stress cardiomyopathy presents like a heart attack. Usually a woman comes in feeling chest pain, chest discomfort, shortness of breath. In Dr. Turner's case, it was an arrhythmia, and often go to an emergency room, and doctors there might think that a heart attack is going on based on laboratory tests or an EKG. And so the patient is often taken to the cardiac catheterization lab for a coronary angiogram to kind of look for that heart attack, what's causing it, and to treat it. That's what Dr. Press does daily. And so here's when they get to the do the angiogram and look at the coronary arteries, that blockage is not seen. And there's no clot in the arteries, but instead what is seen is what you see on panels A and B. Panel A, the heart is in the relaxed diastolic state, and panel B is where the heart is contracting. But what's happening is the whole apex of the heart, the downward half of the heart, instead of contracting, is ballooning out, and that's where you see those yellow arrows. This has been called broken heart syndrome. It's also been called Takotsubo syndrome. It was one of the first cases was described in Japan, and you see that jar is called the Takotsubo jar in Japan, used for catching octopuses. So let's talk about the underlying mechanisms of stress cardiomyopathy. It starts with an emotional stress. It can be something as high magnitude as a devastating earthquake or fire, or the death of a loved one unexpectedly, or it can be something as mundane as an argument with a colleague or a boss at work. But what happens is, as Dr. Jafari mentioned, is that our autonomic center in the brain becomes activated, and we have increase of the sympathetic nervous system, that fight or flight response. And that sympathetic nervous system causes release of epinephrine and norepinephrine and cortisol from our adrenal glands. And those stress hormones affect our blood vessels. The blood vessels may tighten up instead of relaxing, and that may affect the heart. Also, the stress hormones flow and go directly to the heart. And in normal circumstances, that's what we want. When there's a stressful situation and we need to run away or fight something, our heart then responds to these stress hormones by speeding up and contracting more vigorously. But in certain cases, when there's an overwhelming amount of stress hormones, and this can particularly happen, we're trying to figure out exactly why in postmenopausal women, and it seems that the presence of estrogen may have a sympatholytic effect or decrease the sympathetic response. But in this situation where we don't have enough estrogen, these stress hormones basically interact with the heart muscle, as you see there, with beta receptors in the heart. And these beta receptors are very high density in the apex of the heart. So when you get this overflow of stress hormones interacting with those beta receptors, we get that apical ballooning. It's like dysfunction of the apex of our heart. Luckily, we can use a medicine, which you may have heard of, commonly used. Beta blockers can help to block these receptors and treat stress cardiomyopathy. And it usually can be reversible. And so as we're talking about stress and the heart, I will now want to introduce you or reintroduce you to Julie Rowland, our integrative therapist at the Women's Cardiovascular Center, to talk about relaxation and your heart health.
Thank you, Dr. Horwich. And thanks to all for this wonderful presentation of information. We've been talking so much about stress. So what is stress? Next slide. Stress defined. It's important to keep in mind that the word stress is a shortening of the word distress. So when we feel that our livelihood is threatened, our loved ones, our property, that's the fight, flight, freeze that the doctors have been talking about here today. When we are stressed, we definitely feel like we are endangered. Also, we feel a lack or loss of control or chaos. Just today, I was talking with a patient who was talking about feeling a lack or loss of control. So she cleaned out a junk drawer and felt so much better just by clearing out some of that clutter. So these are certainly very chaotic times, very uncertain times, and they are filled with these words: tension, pressure, strain, tightness, out of balance. This is the sympathetic nervous system that Dr. Jafari mentioned in her talk. This is that fight, flight, or freeze. Again, this is a good thing. As Dr. Horwich mentioned, we might need to fight, we might need to run, so we need this activation. Important to keep in mind that this is reflexive, which means it happens automatically. Guess what happens to your blood vessels when you're under stress? Again, this was mentioned by Dr. Jafari. They get tense and tight and narrow. So when we feel emotional stress, physical stress, real or perceived dangers, real or perceived, this is what happens in your body to your arteries. They get narrow, tight, strained, compressed, drawn together. It's no wonder that we are seeing the evidence as presented by Dr. Ann and Dr. Watson regarding heart attacks and stress and cardiovascular health and stress. So this next slide focused primarily on the top. So before menopause, we tend to have more hormones that are relaxing. Parasympathetic nervous system is the rest, digest, renew. Sympathetic, again, is that fight, flight, or freeze, or even friend or fawn. So as we move toward perimenopausal, there's a bit of a balance of these two, of the relaxation and the stress. But once we transition to menopause, there is this imbalance of stress hormones to relaxation hormones. So what do we do about it? What can we do about it? We return to a state of laxity. Again, relaxation. We are returning to the body's homeostasis is what Western medicine calls. And this is that calm, tranquil, balanced, refreshed feeling of relief. And here are some of the techniques depicted here in this slide. This, again, is the parasympathetic nervous system, the rest, digest, renew, respond. We know it because it's familiar. We know it's opposite of stress because we know what it feels like to be good. So what can we do about it? What's the good news, as Dr. Ann mentioned? How do we regulate the nervous system? Well, certainly when we spend time together, as we're doing now, when we give voice to the heart, it is very good for heart health. When we laugh, when we move our bodies, when you feel safe in the presence of another. So that's a lot of what we're practicing when we're keeping up with our checkups and checking in with our clinicians and doctors. When you practice self-compassion, you are also practicing heart health. And when you bring awareness to the bodily sensations, that's something we did together in the centering. Those were the somatic sensations. When you feel emotionally seen and heard, some of the patient stories have referred to that. And when you take deep, intentional belly breaths. So you may have said to someone, you need to relax or you need to breathe, or someone may have said it to you, and that's all fine and good, but how do we relax? Well, now we have this tip sheet, and how do we breathe? A little caution here about breath retention, which is pretty popular these days. That's the holding of the breath. And this is great to do if you're a Navy SEAL, but not if you're a civilian. So we practice deep diaphragmatic belly breaths. This helps regulate the nervous system and can also influence blood pressure and pulse rates to the positive. And finally, when we practice gratitude, we are practicing healthy heart technique. When we are appreciative, in fact, some of the patients that I see express gratitude for their diagnosis or event because it brought them to a change. We talk about the issue can become the portal when we work integratively, when we address the whole person. Speaking of gratitude, I am so grateful to be a part of this amazing team of women, and also to the grant that has afforded me to meet with patients at no cost to the patients. And speaking of patients, it's my pleasure to introduce one of my patients, Emily Green. Hi, Emily. Hello.
Hi, Julie.
Hi.
Hi, so good to see you here.
You as well. You as well. Thanks again for agreeing to tell us part of your story and your journey. Can you tell us how you came to practice integrative therapy?
Well, it's something I've always been interested in, and I'm a person that's always trying to find new answers and patchwork things together. But I came to integrative therapy kind of through the back door. I was very excited to find a really great OBGYN at UCLA. And Dr. Johnson said to me, and I was interested in going on hormone replacement, and he said, I'm not so sure about this. You have some heart issues. And I was really alarmed by that. And then he said, I do have somebody I want you to see. And he said, Dr. Press. So right away, I got to have a visit with Dr. Press. And she said, I don't think hormone replacement is what you need. But what I do think, how I can help you is we have an integrated health therapist. And right away, I think I left the office and I called you right away, and we set up a time to meet, and it has been the most amazing therapy I've ever had. I am I look so forward to our Tuesday meetings. It centers me for the week. I have many health challenges. It's not just heart, but it's multiple things that I've been dealing with. And I say health challenges because I don't say I'm sick anymore. You've taught me beautiful words to help reframe my mindset and how I talk about things. So I've learned from you, like reframing my words. I've had a feeling of being very overwhelmed a lot. And since we've been working together, we've really gleaned on what I do have that's positive and working off the positive. And these wonderful things, the fact that you keep telling me how proactive I am. So I've been building on that positive mindset of what I do have. And I have an amazing team, and I'm constantly building a team of friends and work and just gleaning into the goodness. And then I think partnering with you is like somebody who really sees me and sees who I am and my value. And it's been really great because I feel like I'm building a lifetime toolbox working with you, and just not through my health, but through every aspect of my life. And it's been the best gift ever. So I'm just so grateful. And I have so much love in my heart to share, and hopefully to continue to this more women and more people can see people like Julie and feel supported and seen. Thank you.
Oh, Emily, thank you. Thank you so much for sharing from your heart, speaking from your heart, and for sharing your story with everyone here today. It's healthy for our hearts to give our thoughts and our heart's voice.
Thank you, Julie. I'll see you Tuesday.
See you then.
Thank you.
Well, now we get to turn to the part where we get to hear from you. What are some of your questions? We're going to start by going through some of the questions that you sent in ahead of time. These are the questions will be moderated by Dr. Shah, Janki Shah, and Dr. Shipra Hangurani. And then we're going to open it up to some of your questions.
Good evening, everyone. Thank you for joining us tonight. And thank you so much for sending so many questions in ahead of time. So I will just jump right in. I'll start with Dr. Saltzman. What are the best ways to relieve stress and anxiety? And can somatic therapy help deal with and help heal stress?
Okay, well, that's an amazing and great question, obviously. So I am not sure I have a magic answer, because anxiety is actually different for everyone. And we have to remember that anxiety is actually a spectrum. So I propose a little exercise to understand where you are on the spectrum. The question is this: is my anxiety excessive compared to the good things I have in my life? Excessive meaning, is it constant, chronic? Does it get in the way of my life, of my sleep, of my relationships with others? Am I easily irritable, fatigued, on edge? If the answer is yes, then you may be struggling with unresolved losses and trauma. Something significant happened in your life that you have put under the rug, that you have repressed. In that case, it is recommended to be in psychotherapy and possibly to take maybe medication prescribed by a psychiatrist. Somatic therapy is also very helpful for this type of anxiety. It is a form of therapy based on the body-mind connection. Trauma is often stored in the body, and it has been shown that emotional states can potentially trigger physical symptoms. Somatic therapy, soma means body in Greek, in ancient Greek. Somatic therapy focuses on the body and on the nervous system regulation, creating a sense of safety and control. But I want to be cautious here that you have to be treated by somebody who has been trained in somatic therapy technique. If the answer is no, my anxiety is not excessive, because I am dealing right now with current issues, especially since the fires, right? Then you are on a different side of the spectrum, and you may be able to take short-term actions to lessen the stress. For example, seeking support from professionals or from your loved ones, practicing some techniques, like what Julie was mentioning, that will recenter your focus. I have a practice that I do myself, and I love because it is research-based. Very simple. Many times during the day, find 5 things to be grateful for. At that moment, it can be anything. At that moment, the serotonin in your brain increases immediately, making you feel better. It is not a solution, but it is a good tool to use. In conclusion, I would like to say that don't put the bar too high, thinking that you should never feel anxious. It's just not going to happen, because we cannot stop anticipating and projecting into the future. When life is uncertain, we will anticipate danger. So I know that we all would want to erase this unpleasant feeling, but to lessen the effects of anxiety, first, acknowledge that you are stressed and anxious. Second, take action to seek support. And third, reflect, find meaning to your life. These steps will change the way you experience. I hope I answered a little bit.
Thank you so much, Dr. Saltzman. Thank you. Dr. Watson, what is lipoprotein little a? And are there any updates on medications for elevated lipoprotein little a levels?
Yes. So lipoprotein little a is a very important cholesterol particle that you will not get on a standard cholesterol panel. Your doctor has to specifically order it to get the results. And it's important to know for a couple of reasons. One, it's pretty much genetically determined. And if it's very elevated, you have a significantly higher risk of having a heart attack. I call it nature's perfect recipe for a heart attack, because what it is a LDL cholesterol molecule connected to an apo(a) molecule. The cholesterol molecule causes blockages in the artery. The apo(a) causes blood clots, And then it's sprinkled with a bunch of phospholipids, which cause inflammation. So all of those things are bad. There are currently no FDA-approved therapies to lower Lp(a). Certain things we give, like the injectable PCSK9 inhibitors, do lower Lp(a), but they are not FDA-approved for that purpose. In late-stage clinical trials right now, however, there are several agents that can lower Lp(a), and if the clinical trials turn out to be positive, we should probably see them sometime late 2026 or early 2027.
Thank you so much. Dr. Horwich, can you really distinguish symptoms of a heart attack from anxiety? And how are heart attack symptoms different in men and women?
Okay, let's take the first one, distinguishing heart attack symptoms from anxiety. Right, so with a panic attack, you may feel short of breath, you might feel dizzy, you might feel sweaty, you might even have chest pain. You may, even if not a full-blown panic attack, but anxiety, you may have some of those symptoms. Now, if anyone here has those symptoms and isn't sure, they're new to that person, you know, you're feeling anything in your chest and it's strange, you know, we can't blow it off to anxiety. We should seek medical care right away. Now, with the right tools, which are pretty easily available, such as an EKG, an electrocardiogram, and labs that we can draw, you know, blood tests, we can determine pretty quickly, you know, if something's going on with the heart, and what needs to be done. But it can be, you know, until you know your own body and you've been tested and you've talked to your doctors about it, you know, you may not know, and therefore it's always best to seek care. How can heart attack women's differ in men versus women? In general, that, you know, it's been called the Hollywood heart attack, where someone like clutches their chest in severe pain and falls to the ground, is more of a man's way of feeling a heart attack, although of course, you know, it can happen in both. The symptoms of heart attacks in women can be more complicated, more subtle, maybe reflecting women's personalities, but, you know, just, you know, maybe a feeling of a sense of doom, feeling kind of sweaty, feeling nauseous, really fatigued. I think kind of throat pain, jaw pain. All of us here have heard women describe that's what's happened when they were having the heart attack. They didn't know what was going on. I think even stomach pain. I think Dr. Watson once taught me or told me, you know, anything above the waist, if you don't know, you know, be worried. Don't feel bad seeking care if you're a woman or a man.
Yeah, I agree with that wholeheartedly. Any symptom from your navel to your nose that comes on with exertion, either physical or emotional, and goes away with rest, got to get it checked out.
100%. Dr. Press, one of our participants wrote in, heart valve problems run in my family and several did not survive surgery. What's the latest treatments as far as non-invasive treatment options for valvular disease?
Well, that is like music to my ears because, you know, I'm very, very excited to talk about valvular heart disease. And so there's so many exciting developments in the world of interventional cardiology or structural heart disease. So we have much less invasive techniques to repair valves. So historically, valve surgery was basically the main treatment for patients who had symptomatic valve disease. But in the past, probably decade, we've had just an unbelievable explosion of devices. The first one that was FDA approved in 2016 is called the transcatheter edge-to-edge repair system, which is basically delivering clips to the valves to treat leaky valve. For many years, decades before, actually, we've had a very simple procedure to treat rheumatic heart disease by just using a balloon to expand open the valve. But more recently, we've had approvals for even percutaneous valve replacements. The TAVR valve, which is done through the leg, can replace the aortic valve. We've had that for many years. But just this year, we had a second valve for the tricuspid valve approved. So it's really, really exciting. I'm expecting the mitral to come in the next year. So 3 out of our 4 valves will probably be able to be replaced through the groin soon. And we have several percutaneous repair therapies that are down the pipeline as well, but we already have one approved that works very, very well. So it's exciting. Thank you for the question.
Thank you. Dr. Hingarani, one of our participants wrote in, I was recently diagnosed with obstructive sleep apnea. I would be interested in learning about the relationship between sleep apnea and risk of heart disease. How important is treatment with CPAP for obstructive sleep apnea?
I like to think of sleep apnea as kind of the hidden risk factor for heart disease that a lot of people don't think about, because it can play a role in many different areas of heart disease. When a patient is suffering from sleep apnea, they're having reduced oxygen levels periodically throughout the night, and that reduction in oxygen level causes stress on your cardiovascular system. And one of the first things that can result is high blood pressure. Oftentimes people will have elevated blood pressures in the morning, and I'll ask that person if they snore, and they'll say yes, and that will often lead to a sleep study and diagnosis of sleep apnea. So high blood pressure is just one of the many ways in which sleep apnea can affect your cardiovascular system. Those times of low oxygen level can also facilitate oxidative stress, which can also increase the risk of atherosclerosis, which is plaque buildup, and thus, lead to more heart disease in the future. There's also been shown to be a link between sleep apnea and atrial fibrillation, which is now moving into the electrical parts of heart disease. So there's so many different ways in which untreated sleep apnea can affect your heart. There are potentially many different treatments for sleep apnea, CPAP being one of them. The way in which CPAP works is by providing a continuous flow of air into your lungs so that you don't experience these drops in oxygen. So if your sleep specialist is advising you to do a trial of CPAP, I would highly encourage you to do so.
Thank you. So our next question is, should we be concerned if stressful situations give us heart palpitations? I'll take this one. So it's very common, as most of us have probably experienced, our heart pounding when something stressful happens or we hear bad news. And that's our body's fight or flight sympathetic nervous system raising our heart rate and increasing our adrenaline production. What differentiates something that's normal to feel from not is if you're feeling dizzy or feel faint with it, that's a red flag and you should certainly seek attention. If the palpitations are frequent or intense or are happening without a clear trigger, you're not even stressed out, it's definitely a good idea to seek medical advice to rule out any kind of underlying condition there. Our next question is for Dr. Jafari. What's the latest on hormone replacement and risk of heart disease? How do bioidenticals affect the heart?
Thanks, Donkey. So, for the first part, most of our literature on the safety of hormone replacement therapy, I would say the best quality is really old literature. But what we do know is this, that in women without a history of cardiovascular disease, no history of heart attack, stroke, who are young, less than 60, within 10 years of menopause, hormone replacement therapy is likely safe. However, this really requires an individualized assessment for risk with you and your doctor. And we routinely see women in our center who maybe have some risk factors for heart disease, and their doctor is unsure if it would be a good idea for them to take hormones or worried about the risk, like one of our patients shared with you. So if there's uncertainty, ask to see, a women's cardiovascular specialist to understand your risk. And our goal at our center is never to tell you what to do or what not to do. It's just to help inform you, help you understand your risks so you can make the best decision for your health and balance that with controlling your menopause symptoms. And then the second piece of the question was about bioidentical hormones. Technically, bioidentical hormones are hormones that are derived from plant extracts that mimic the same molecular structure of hormones that are found in our body. But really in kind of society and popular culture, when people are saying bioidentical hormones, they're referring to these custom compound multi-hormone regimens where the dose is adjusted or escalated based off measuring hormone levels. And there is really no scientific evidence that bioidentical hormones as opposed to conventional hormone therapy is any safer or more efficacious. And also these compounded hormones that are often found for bioidentical hormones really are not rigorously tested for safety or efficacy. And we sometimes don't know if the doses that they say are in them are in them. So for those reasons, we don't advise that patients seek out bioidenticals as a safer alternative.
Thank you so much. Julie, I think you might be best for this question. What stress relieving techniques have the most research or data to back up their effectiveness? For example, yoga, meditation, cognitive behavioral therapy.
Thank you for the question. Yes, the most studied is cognitive behavioral therapy. That was started in around the 1960s. Meditation is second, but we didn't start to study that really until the 1980s. Primarily pioneer of mindfulness-based stress reduction, John Kabat-Zinn. There are many, many studies on the strength of practicing meditation, one out of a little-known college by the name of Harvard, where the matter in your brain, in your prefrontal cortex, the more evolved part of your brain, actually increases. They've proven this with PET scans. It increases with meditation. Yoga is very hard, although a lot more studies are coming up, but it's very hard to quantify because what kind of yoga? How long, where, which poses, which postures, were breathing techniques included. So it's coming, but not quite there yet. And also breathing. Breathing techniques have some study, but that's pretty much the order now.
Thank you. And Nicole, I think I want to know this too. How does one kick a sugar addiction?
All right. So I want to highlight again mindfulness and mindful eating and awareness, and going back to that, tapping into our emotional state, because when we're stressed, our serotonin, which is our neurotransmitter that helps us to feel calm and centered, will decrease, often prompting carbohydrate cravings. And again, when we're stressed, we're reaching for the more processed and refined carbohydrates. We don't get stressed and decide to eat some broccoli, which is also a carbohydrate. So number one, checking into your emotional state and noticing if you're gravitating towards certain foods under certain emotions or feelings. And then it could be making swaps for less refined sources of sugar and carbohydrates versus a refined sugar. Also, I hear from many people like, oh, I'm addicted to sugar, cookies, ice cream, baked goods. Those foods have sugar, but they're not all sugar. So I feel like a true sugar addict would really just be like eating a bowl of sugar straight. And I think if anyone actually was doing that, over time, it would be too sweet and you would be able to stop. But when we have the combination of sugar and fat together, it really takes the brakes off of our ability to stop eating. And so some other tips beyond, switching to things like fruit or maybe dried fruit that are some more concentrated sweet, to stay away from commercially baked goods, do some baking at home. You can always reduce the amount of sugar in a recipe by 25, 30, 50%. So if the recipe calls for a cup of sugar, you could use half a cup of sugar. You can still have the cookie, but it'll be a less sweet version. And you also want to decrease your intake of refined sugars kind of slowly over time and taper down, because often when we do a dramatic cutoff of something like that our body is used to, it can lead to a rebound and kind of overdoing or possible binge on those types of foods. So A slow decrease helps to change the taste buds. And again, in that process, using your mindfulness, making other swaps to help overcome refined sugar intake.
Thank you. That was fantastic. I think in the interest of time, let's move to any live questions with Dr. Hingorani.
Thanks, Dr. Shaw. I've been monitoring the question and answer board, so we're going to try to get to as many of these questions as we can. The first question will be for Dr. Watson. The question is, if I had high cholesterol all through my 20s, and then I started improving my cholesterol in my early 30s, does this reduction reduce my risk of cardiovascular disease in the future, or has the damage already been done?
That's a great question. So every single cardiovascular risk factor, the amount of damage it does depends on how high it is and for how long it's been high. So sort of the area under the curve. So what we think about is like cholesterol years. How many years has your cholesterol been high? You've definitely improved your health by lowering it at whatever age you lower it. But the question is, has there already been damage from the years of high cholesterol that we need more intensive medical therapy to treat it? And that's something that only you can find out by talking with your doctor and maybe getting special tests done, imaging, things like that, that can help them decide that. But definitely improving risk factors whenever you can is the right thing to do. But once we have damage already built up, we may need to increase our use of medications to help deal with that as well. I hope that helps.
Thank you, Dr. Watson. The next question will be for Dr. Press. I've been noticing some episodes of racing heartbeat when I'm doing nothing at all, and I will decide not to do my exercise for the day. Is that the right decision? What could be happening?
I think if you're feeling your heart race, I think you should talk to your primary care doctor, or, you know, you can get an opinion from a cardiologist. There's so many things that can cause heart racing. It can be normal adaptive response to stress or fatigue, or, you know, other health conditions could be happening, anemia, arrhythmias, or other metabolic disturbances. So the differential diagnosis is really too broad to say. Generally, if this is a new symptom, if it's your heart rate's fast at rest for more than a few seconds and it's prolonged, or you have any associated symptoms like dizziness or lightheadedness, shortness of breath, or anything like that, you just need to talk to a physician. So I would say that before deciding that it's safe to exercise, first just get checked out, make sure that everything is okay.
That's great advice. This next question will ask Dr. Horwich. I keep being asked to perform moderate intensity exercise. Can you explain what that means? Should I be monitoring my heart rate to a certain degree?
There are two ways to look at it, and I think the easiest one is to not focus on heart rate, but to focus on your ability to exercise and how hard it is for you. We actually do that, like even in our cardiac rehab. We want people to we ask, like, there's a scale, like how hard is this exercise? And there's different ways to look at it, but basically when you're doing, some people call it even like a zone 2 would be moderate. When you're exercising, you want to be able to carry on a conversation, you want to be able to talk, but it shouldn't be as easy as usual. You don't want to be gasping for breath, like you can't get a sentence out. That would be intense, so moderate is just below that. We talk about maximal heart rate for your age, and you can look at tables for that. For a stress test, we want to get people to 85% of their maximal predicted heart rate. So below that, between like 70 to 80 can be a moderate exercise. Those are two different ways to look at it.
Thank you, Dr. Horwich. The next question will be for Dr. Saltzman. This question, or the statement, is: I feel incredibly stressed all the time between full-time work, 2 toddlers, and no help. I feel like I feel very stressed. I don't have time to seek behavioral therapy to learn coping mechanisms, although I am aware of how destructive that is and can see the train wreck ahead. Is there any data on the use of psychedelics to treat trauma and stress as isolated therapy?
Okay, well, thank you. It's a very rich question. Number one, there is something important that this person is saying, I don't have any help. So I would suggest considering the level of activity. This is very important for women in general. Women tend to do exactly that, work, take care of the kids, take care of many things at the same time, but they feel that all the burden is on their shoulders. They carry the weight. And that can be extremely stressful, obviously, and not good for their health. The other thing I want to say also is that we have to absolutely pay attention to our health, but it's also important to remember that what we're talking about here can be very scary, but it's important to take steps to improve your well-being. Don't feel guilty, don't feel bad, don't feel life is life sometimes, but just what I think the message we would love to convey to all of you tonight is just pay attention. Just think about your heart, think about yourself. Yes, you don't have time for CBT, cognitive behavioral therapy, and maybe you don't necessarily need it. What you probably need is a little bit more time for yourself. What you probably need is probably some help. Now, the other term that was used is trauma. Now, trauma, as I mentioned previously, is on the specific side of the spectrum of anxiety. If there is trauma, then I would 100% suggest you consult, you seek advice and guidance and treatment with a psychotherapist. Trauma being an unexpected life-threatening situation, past history of abuse and neglect can be, stored in the body, as I mentioned before. So there is not one answer to that very complex question. My advice is think about yourself, try to find some time to yourself and get some help.
Thank you, Dr. Saltzman. The next question will be for Dr. Jafari. I've been told that alcohol affects blood pressure. It has an initial relaxing effect on the brain and body, so I don't understand why it's so bad. Could you explain?
Yeah, that's a complicated question, but a really good one. I think what we learn more and more is that while maybe in the transient moment, it may make you feel relaxed, it really is not addressing the underlying processes that are making you feel feeling stressed in that moment. So the chronic stressors are there, and we know that alcohol is toxic to the body. It impairs your sleep, it contributes to weight gain, it increases your blood vessels. It's directly toxic to heart muscle. So some people have heart failure from the toxicity. It's linked with Alzheimer's, it's linked with cancer risk. And so really have been no shown cardiovascular benefits of alcohol. And if anything, alcohol use is linked, particularly in excess, with increased mortality or increased death. So I wouldn't think of it as a coping or relaxing technique. I would use the tools that have been presented today to really address why you think you need alcohol to feel relaxed so that you can, begin your journey of stress management and a healthy heart.
Okay, thank you, Jafari. So unfortunately, we're going to have to wrap it up with the live questions at this point. So I'm going to turn it back to Dr. Watson.
Thank you so much, everyone. My heart is so full. Thank you so much to our patients who shared their wonderful stories. Thank you to all the panelists. Thank you to our wonderful community who joined us tonight. Remember, we are all here to keep each other well, and we appreciate you so much. A huge thank you to Marcy Gringlas and Joel Greenberg and the Seed the Dream Foundation. You've heard about so many of our wonderful offerings we are able to give to our patients free of charge. That is all due to this fabulous, wonderful philanthropic donation from Seed the Dream. And we are so grateful. We can never thank you enough. I'd also like to thank our advisory board. We have a number of wonderful women who help guide us and center us and make sure we're on the right track. Make sure we keep the patients and the community and everything that's important at the center of everything we do. We could not do any of this without you guys. We are so, so grateful. We also have many, many opportunities for any wonderful people who would like to join us to become involved. So please, if you have any interest at all, take Lindsay Walton's email address and phone number down there and feel free to reach out. And so just so grateful for all of you. Thank you for attending. You can learn more about our center via that website. That's right there. Snap a picture. We also are so grateful for any philanthropic support anyone can give us. As you've heard, there are so many things that we offer that we know are so important that are difficult to access, but because of the wonderful philanthropic help we've received, we are able to offer to our female patients free of charge. Finally, we really just want you all to remember and embrace our philosophy and our motto: move frequently, eat thoughtfully, and connect deeply. Thank you all for joining us, and have a great night.